What are some signs or symptoms I should look for if I suspect heavy implantation bleeding?
Hello viewers. Today, we're going to talk about a very important topic, heavy implantation bleeding. This type of bleeding happens in the early stages of pregnancy and is completely normal for some, but for others, it can be a sign of complications. Knowing the signs and symptoms is crucial, and today we're going to discuss what you should look out for if you suspect heavy implantation bleeding.
What is implantation bleeding?
Implantation bleeding is a form of light bleeding that can happen as your embryo attaches itself to the lining of your uterus. It usually happens around the same time your period would normally start, and this can often lead to confusion. However, the key here is that it is typically lighter and shorter in duration than a normal period.
Signs and symptoms of heavy implantation bleeding.
If you're experiencing implantation bleeding that seems heavy or is concerning to you, here are some signs and symptoms you should look out for. 1. Volume and duration. Heavy implantation bleeding is usually more in volume than normal spotting and can last for more than a few days. If it's heavy and prolonged, it's a sign you need to consult with a healthcare professional. 2. Pain or discomfort. While some discomfort can be normal, severe pain or cramping can indicate a problem. 3. Color. The color of implantation bleeding is typically lighter, often being pink or brown. If it is bright red and similar to menstrual blood, this could be a sign of heavy implantation bleeding. 4. Presence of clots. Regular implantation bleeding doesn't usually come with clots. If you're seeing clots in your bleeding, this may be a sign of a heavier bleed.
When should I seek medical attention?
If you're experiencing any of these signs or symptoms, it's important to seek medical attention promptly. Heavy implantation bleeding can sometimes be a sign of a more serious condition like a miscarriage or ectopic pregnancy. Therefore, don't hesitate to consult with a healthcare provider if you're experiencing these symptoms. Remember, your health and the health of your baby are of the utmost importance. So, that wraps up our discussion on heavy implantation bleeding. We hope this has been informative and helps you understand what to look out for. Listen to your body and don't hesitate to seek medical advice if something doesn't feel right. Remember, every pregnancy is unique and what's normal for one person may not be normal for another. Here's wishing you a safe and healthy pregnancy journey.